Hi, welcome everyone to our Cecilia Health webinar. Today we will be talking about chronic kidney disease and cardiovascular disease as well. I'm Emily. I'm one of the dietitians and diabetes educators, and I'm just here at the beginning part. Wing, one of our other dietitians, will be presenting today. Here at the bottom, you will see a phone number 1-800-263-6317. That's in case you're having any tech issues, please reach out to that number. Thank you all again for joining us here today. Now, as if you've been here before, you know that we do more of an interactive program. The idea is that we do a short presentation followed by some time for discussion. You will see on your toolbar, there is a chance, there's a questions drop down arrow section, and you can type in any questions that you would like Wing to talk about today with that. And she's going to cover a lot of information, but if there's something else you have questions about, please enter in your question for her to answer at the end. And just as a disclaimer, we do know that the information you are about to hear may motivate you to make some changes, but please do talk to your doctor before making any changes to your current routine. The Cecilia Health Registered Dietitian will provide strategies to help you manage your CKD, but this online Q&A session is intended to give general advice. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecilia Health Registered Dietitian. So today, like I said, our presenter is Wing Lee. She is a registered dietitian and a kidney health coach. She has experience working with patients who have CKD, cardiovascular disease, hypertension, weight issue, and diabetes for over 15 years. She lives in Southern California with her family and enjoys baking with her daughter, reading, hiking, and traveling with her family. So thank you all again for joining us. And Wing, I'll pass it off to you.
Thank you so much, Emily. Really appreciate that. And I'm so glad to be here. So today we're going to talk about heart disease, and we are going to talk about CKD and why is that important. That is related to the heart disease. We're going to talk about symptoms, causes of heart disease, and also some tests that can be done for diagnosing for heart disease, and also treatment and prevention as well. And at the end, we will be doing talking about medication surgeries and also healthy eating for heart disease and CKD as well, which is very important for today. Now, heart disease is something that it's basically it prevents you to that your blood is not pumping enough blood. And so there's a range of conditions that affect the heart, and it's considered as heart disease. And these can be included as blood vessel disease, such as coronary artery disease, irregular heartbeats, heart problems that you're born with, and disease of the heart muscles, and also including heart valve disease. So there are many forms of heart disease that can be prevented or treated with healthy lifestyle choices, which we're going to be talking about more toward the end of the presentation. Now, when the kidneys don't work well, there more stress is being put on the heart. It's because when someone has CKD, the heart needs to pump harder to get the blood to the kidneys, and that's why this can lead to heart disease, and which is one of the leading cause of death in the United States. Now, with blood pressure, we always talk about blood pressure every time with our health coach, is because blood pressure is such an important thing for CKD. So CKD, when the kidney is not functioning well, um, that affect the heart. And so blood pressure is it's a CKD complication that can lead to heart disease. And so basically what I'm trying to say is that when the kidney function is not doing well, it can affect that the blood pressure can go high. And when your blood pressure is high, it can affect the kidney function because the kidney has a lot of many little blood vessels. So that's the cycles right there. Now, there are some symptoms of heart disease that we want to be aware of. If you realize that for men, most common symptoms in men are discomfort or tingling in the arms, back, neck, shoulder, or jaw. It can be chest pain. It can be shortness of breath. For women, there's some additional symptoms, which can include sudden dizziness, heartburn-like feeling, cold sweat, unusual tiredness, nausea, vomiting. So these are some of the symptoms that we should be watching for. Now, there's a couple different cardiomyopathy here, which is it's also one of the causes of heart disease. It means it's thickened or enlarged heart muscle. So for dilated cardiomyopathy, the cause of this most common type is not known. It's unknown. It may be passed down through families, and it's typically start in the heart's main pumping chamber, which is the left ventricle, and many things can cause damage to the left ventricle, including heart attacks, infection, toxin, and even some drugs, including cancer medications. Another one is hypertrophic cardiomyopathy, and this one is usually passed down through families. Restrictive cardiomyopathy is the least common type, and this one can occur for just no known reason. Sometimes it's caused by a buildup of protein called amyloid in the heart or connective tissue disorder. Actually, one of my members have this condition. It's pretty tough for him because he has to go through some clinical trials and trying to test out medication that's helping with this condition. So it's really not easy for this condition. Now, other things, other causes for heart disease is coronary artery disease. It's a buildup of fatty plaques in the arteries. It's called atherosclerosis, and it is the most common cause of coronary artery disease. And the risk factor including poor diets, and if we eat a lot of saturated fat like red meats or processed meat, if we eating a lot of high salty snacks, but not a lot of fruit and vegetable. So that's not very good. Lack of exercising, obesity, and smoking as well. So healthy lifestyle choices can help lower the risk of atherosclerosis. Now, irregular heartbeats, other causes, cardiomyopathy, like we have mentioned just before, diabetes, drug misuse, emotional stress, too much alcohol or caffeine usage, heart problem, present at birth, also high blood pressure, which is the most common cause. Smoking, heart valve disease, and use of certain other medication, including those that's bought without prescription, including herbs and supplements. Now, other causes are heart infection, including bacteria, viruses, parasites, heart valve disease, including rheumatic fever, infections, and connective tissue disorders. Now, there's some tests for the heart disease. It's ECG or EKG, which is the electrocardiogram. So ECG is a quick and painless test, and that records the electrical signals in the heart, and it can tell if the heart is beating too fast or too slow. Another one is Holter monitoring. It's a portable ECG device that's worn for a day or more to record the heart's activity during the daily activities. So this one can detect irregular heartbeats that aren't found during a regular ECG exam. I believe I have like maybe two of my members actually have one of these similar to this device where they have to wear it all day long to check, make sure that their heartbeat is normal. So it's something that if your doctor think that can tell more than just a regular ECG, they will do that at home. Now, echocardiogram, this non-invasive examination use sound waves to create detailed images of the heart in motion. So it shows how blood moves through the heart and the heart valves. And it can also help to determine if a valve is narrowed or leaking. Exercise tests or stress tests, which is a very common. This involve walking on a treadmill or riding on a stationary bike while the heart is being monitored. So exercise test, it helps to reveal how the heart responds to physical activity and whether heart disease symptoms occur during exercising. So if you can't exercise, you may be given medication. It really depending on the results of these tests and the doctor's diagnosis. Now, another test is cardiac um, catheterizations. So this test can show blockage in the heart arteries. So a long, thin, flexible tube, which is the catheter, is inserted in the blood vessel, usually is in the groin or wrist, and it then guided to the heart. So the dye flows through the catheter to the arteries in the heart, and it helps the arteries to show up more clearly on X-ray images during the test. The CT scan for the heart, it's just basically you lie on the table, insert inside a donut-shaped machine. So a big X-ray tube inside the machine will rotate around your body and collect images of your heart and chest. The MRI scan, it uses the magnetic field and a computer-generated radio waves to create detailed images of the heart, so it can be more clearly seen. Now, medications. There are so many medications out there for treatment and prevention. A lot of them are for blood pressure, blood thinner, like on this slide is saying anticoagulants. So the blood thinner helps to prevent the harmful clots. And we also have this antiplatelet agent. It also prevents clots by preventing the blood platelets coming together, sticking together. The ACE inhibitors, it allows the blood to flow more easily. And the angiotensin II receptor blockers to keep the blood pressure from rising. So you can see that different medications, they have different functions. So it's to prevent clots, is to make the blood flow easily, to keep the blood pressure from rising. So there's different functions. More like it also improves arteries opening and blood flow with the angiotensin receptor, the inhibitor, also the beta blockers. It lowers the blood pressure and make the heartbeat more slowly but less force. So because when you're having high blood pressure, the pressure is a lot on your blood vessels. So this medication is helping with that. The combined alpha and beta blockers that treat the blood pressure in heart failure, and the calcium channel blockers that help to decrease the heart pumping strength and relax the blood vessel when it should be. For cholesterol lowering medication, it's important because of the plaque that's being built up on the inside the blood vessels. It blocks the blood flows when it's like plug up, and so that's why there's cholesterol lowering medication. Now, these affect the liver and some in the intestine, and others interrupt the formations of cholesterol from circulating in the blood. And also, that's why exercising is very important, because when we're exercising, we have the blood flowing, and it's important for cholesterol, it's important for blood sugar management, and it's important for blood pressure. So exercising is very important here. We have medication that help increase the force of the heart's contraction if it's not contracting enough. Diuretics that help to get rid of some excess fluid inside the body, which in return, it reduce the workload on the heart. Vasodilators, which relaxes the blood vessels and decrease the blood pressure. Now there's this treatment, there's a lot of different treatments for the heart, and there are some common ones that you probably are aware of. Angioplasty, which is it's a deflated balloon, is thread into the coronary arteries to widen the block areas, which the blood flow has been reduced or cut off. So a lot of people has been having angioplasty. Another one which is very common, which is the bypass surgery. It takes the arteries and veins from other parts of your body to reroute the blood around a clogged artery. So it bypasses those clogged artery, it's a very big surgery, and it's a very common one as well. And there's some other one like minimally invasive heart surgery. So they put small incision that's being made in the chest, and the chest arteries or veins from the legs, which is attached to the heart, to bypass the clog. So there's different things that we can do to bypass this clog. If they're really clogged up, then there's nothing that we can do about it. Then the surgeon will be doing these procedures to bypass those clogs. Stent placement is also one that's very common, and they use a wire mesh tube to pop open an artery, and then they put the stent inside the artery so it can remain open. So that's also a very common one. And another one, which is very interesting, the last one, the transmyocardial revascularization procedure. And personally, I don't know very much about this one, so I went to take a look, and actually there's incision is being made to expose the heart, and a laser will drill a series of holes in the heart so it can relieve the chest pain. It's very interesting. They still don't know why that can be done to relieve the chest pain, but this procedure that has been done for some time now, that to help with some of the patients with chest pain. Now, lifestyle changes for treatment and prevention of heart disease. This is very important because we always trying to emphasize trying to be active. Of course, I think we all want to try to be active, and it's recommended for 30 minutes or more for most days. But I know a lot of our patients, sometimes they may have arthritis, they may have back pain, and so I think it does not matter. Whatever that you can do to get more blood circulations, even just like 5-10 minutes of walking with the walkers, or if you can go outside to have some brisk walking, that's awesome for about 10-15 minutes, and break it up in between. Sometimes we have things to do, we cannot spend so much time in exercising. Block those time and just treat it as something like you have an appointment with your doctor. Like Monday morning, I'm gonna get up and maybe I'll just do about 10 minutes walking after breakfast or something. Do it on a routine basis, establish that routine, because that is very important with exercising. We're talking about trying to exercise your heart, and the more your heart is pumping, you're exercising your heart, your muscle is stronger. And so that is important. And it's also good for blood pressure. It's good for blood sugars management. So this is one thing that I think that is very important beside we're eating healthy. Now, stress management is also one thing. If I know right now there's a lot of things going on. We have a lot of stress at times with dealing with different things, families, and um, our life, or maybe I have some members they have multiple medical conditions, and so this is important because it's helpful for blood pressure. When you're not as stressed, um, your blood pressure won't be going up as high. And so find out some hobby that you like to do. And I have members that are doing puzzles, and I love puzzles, and things that can just calm us down. Maybe just when we're stressed, you can sit on a recliner and close our eyes, think about the oceans, think about something that you enjoy. Um, and now there's, with phones, the technologies are so much greater now that you can open up some YouTube videos, or just listening to the water, the raindrops, and things that can be helpful just right at your home. So now sleep is very important. We're always trying to aim for 7 to 8 hours of sleep, and sometimes it's difficult. Some of our members may be night owl, like to sleep late and watch TV and relax. But as long as you're taking enough adequate sleep, which is important because when we're having adequate sleep, we feel energetic. We know what to choose better when our brain is more focused. So, like I know I need to choose to eat the vegetables and fruits for snacks and between meals today. And sometimes we don't have enough sleep. We might be, oh, I just want to get some chocolates or something. And so our mind can be more focused and make better choices when we have better sleep. So it's really important. Also, get enough oxygens for our brain, which is important. Don't smoke. So yeah, smoking is a major risk factor for heart disease, especially atherosclerosis. So creatine is the best to reduce the risk of heart disease and its complication. And yeah, this is definitely a factor, and smoking is one big thing that we want to avoid. And also take medication as prescribed by your healthcare provider, which is one of the treatment. It's important because for blood pressure management, we a lot of the time we use medications together along with exercising and healthy eating. Um, Now, managing other conditions for the treatment and prevention. So control blood pressure, definitely uncontrolled blood pressure increases the risk of serious health problems. So if you want to get your blood pressure checked at least every 2 years, if you're 18 or older, if you have risk factor for heart disease or are age over 40, you may need more frequent checks. And I know a lot of our members, they have their blood pressure machine at home, and if you already have high blood pressure, I recommend at least once or twice a week, if not every day, just to know that, oh, okay, my blood pressure is fine. Um, and get a cholesterol test. Ask your provider for a baseline cholesterol test when you're if you're young, in your 20s, or at least every 4 to 6 years if you're young. But I know a lot of our members, even myself, they start doing it earlier or in a yearly basis, especially with family that may have high cholesterol or heart disease in their family history. Diabetes. If you have diabetes, high blood sugar control can help reduce the risk of heart disease. And of course, when our blood sugar is high, it can damage the blood vessels. So it's important to manage the blood sugars. For nutrition, it's important. Yes, it's important to control our portion size, because when we're overloading our plates, that can lead to consuming more calories, more fat, or more carbs than we should. One thing we can do is that you may have heard about My Plate. It's something that the government have been used to visualize how much carbs and vegetables and things that we should be eating. So half of the plates fill up with your fruit and vegetable, 1/4 of the plates, that's your protein, and 1/4 of the plates it's your carbs. So that's just easier to visualize. Of course, if it's bigger person or smaller person, we have different um, intake portions size. Now, eat more fruit and vegetables and choose a non-starchy vegetable over starchy. Of course, things like sweet potato, those are starchy vegetables, those are healthy. But when we're eating too much, that's also considered a carbohydrates. And that's why we want to choose more green leafy vegetable, cauliflower, broccoli, um, beets, things that's colorful, and because it contains a lot of antioxidant, it's good for our hearts, it's good for our cells. So yes, eat more fruit and vegetable. High fiber grains and starches. So always trying to look for 100% whole grain or whole wheat as the first ingredient, because the first ingredients, it contains the most in this product, if it's in the bread or if it's in crackers. So if it's say whole wheat as the first ingredient or second, it usually should be the first. Then it means that it contains most of this in this product. Legumes, beans, peas, lentil, beans, they're all high in fiber and they have proteins and they have minerals and of course vitamins. So legumes are very healthy food. Limit unhealthy fat. So trying to have lower consumption of saturated fat. It's in a lot in red meats and also high-fat dairy products. Avoid trans fat, limiting fried food, fast food, and processed baked goods, because oftentimes they contains the fat and the oils that's not so good. And choose a healthy fat like olives, olive oil, nuts, seed, avocado, fatty fish like salmons and sardines. Um, like a Mediterranean diet, they contain a lot of these items and they are anti-inflammatory, which is just great. It's great healthy fat. Choose lower fat protein sources such as whole eggs, quinoa, and quinoa you can put it in your salad. And egg whites and fish are great option. And of course, last, we want to minimize the concentrated sugar, which is can be from sweet treats, soda, and juices, because they are very concentrated in sugar. And sugar are pro-inflammation, so we want to minimize those. Now, nutrition for a healthy heart. So we want to limit and reduce salt. And the reason is because some people, they're sensitive to salt, even though when we're not sensitive to salt, when we're having high blood pressure, we're eating too much salt, that can affect our blood pressure. So 1 teaspoon of salt, it's about 2,300 milligrams, and which is, that's the recommendation to have or less than 2,300 milligrams a day. When we want to avoid salt substitute, let's say new salt or no salt, as these are made with potassium and that can raise the potassium to a dangerous level. Choose canned and jar food that say no salt added on the package, and you can rinse the water and the juice out with water so it can decrease the salt that's remaining in this food in the can and the jar. Choose no salt added snack, unsalted or no salt pretzel, etc. Prepare and cook your meals from scratch using one of our kidney friendly recipes, and so you can control the amount of salt in your food. Use fresh and dry herbs and spices to add extra flavor to your dishes instead of salt. And I know some of the seasonings, they are made without salt in there. Just watch out if they don't have extra potassium in there, but they're great and convenience to use to spike up our meats and our fish, so we don't need to use that much salt. Now, drink water instead of sport drinks or soda. Definitely water. Um, I think one of the members told me that she didn't drink enough water and the blood pressure went higher. And it's true, when you don't drink enough water, your blood pressure can go high. And so make sure you drink enough water. When you eat out, ask a server for your food to be prepared without any added salt, or tell them to put the sauces on the side, the dressing on the side, so there won't be extra sodium on your food. Plan ahead. So create daily menus if that's possible, following the previous mentioned guidelines. Allow occasional treats. A treat that you can enjoy occasionally will not derail your meal plans. And the reason is because sometimes, when we trying to stay away from these treats, and we might be coming back wanting to crave for more. So sometimes when we go out with friends and there's somebody's birthday or Christmas, I know Thanksgiving is coming, so we can still have those treats. And I also tell my members, I think yesterday, um, like if you're thinking about, oh, Thanksgiving is coming, we're gonna get together and doing a feast, like excited about all this food that we're trying. But thing is that we can maybe pick a bite here and there, a spoonful, or think about maybe if I'm gonna get protein, some more vegetables, and if there's dessert, and we can pick one or maybe one bite or two bites here and there. And actually, you'll find out that your plates will become really full because you're trying to try different things, right? But we're not um, putting more food on your plates. But think about, plan ahead, the portions and the plates that you're filling in, not to overfilling your plate. But I like the idea that we have occasional treat, because we I think our tongues having the sweet taste, having salt, and we can taste bitterness, and we can taste sour. There's a reason, and we love them. So I think it's good to just think about the portion size and as occasional treats. Yeah, so if you have any questions, you can use the question tab on your toolbar. And if you have questions, you can put it in there for us to answer the questions. And thank you so much. There's an upcoming event that if you're interested in our upcoming live events, there's long-term maintenance and emotional barriers of CKD in October, and there's also CKD and diabetes in November. And by the way, there is also, if you're interested in more about heart nutrition for the heart, there's a Happy Hearts webinar. It's going to come up, so be sure to check it out.
Thank you, Wing, so much. And like Wing was saying, we do have more resources that are out there if you're looking for more information, and that might be related to heart health or with kidneys as well. As always, you can check out our website or also our Facebook page. But please also talk to your dietitian or your health coach that you are working with. Right? We want to know your questions so we can address those as well. But I just want to thank you all again so much for your time. Thank you, Wing, for your expertise as well. And have a wonderful day, everyone. Thank you. Bye bye.